Hi, today we gonna talk about SLS, suppurative lung syndrome. This syndrome is characterized by cough, with excessive expectoration, and is fetid, and purulent, and paroxysmal, and related to position. Suppurative lung syndrome includes 4 diseases. First, bronchiectasis. Second, lung abscess. Third, infected cystic lung. Fourth, empyema. First, bronchiectasis is persistent dilatation of terminal bronchi, and caused by obstruction or infection. Obstruction could be congenital or acquired as foreign body aspiration. Infection could be congenital as hypogammaglobulinemia, meaning low serum antibody level in the body, acquired as pneumonia and TB. And I recommend to watch the pneumonia video, pretty sure you gonna love it. Obstruction and infection, these two will lead to dilatation finally. Of course, the infection and dilatation will be associated with excessive mucus. That will cause excessive sputum and dyspnea. Bronchiectasis, mostly affecting patchy basal bilateral of lungs, doing pus inside the lumen, and fibrosis outside. The patient comes with fever, headache, anorexia, malaise, and cough with excessive sputum, increases on leaning forward, and the hemoptysis is common, and dyspnea. Like pneumonia on examination, but as I said, basal bilateral patchy, meaning increased TVF on basal part, but decrease on upper part due to compensatory emphysema, and dullness on basal part but hyperresonance on upper part. X-ray may show normal or honeycomb appearance. Second, lung abscess is infection of the lung that results in necrosis of the pulmonary parenchyma, or localized area within lung parenchyma, of necrosis, suppuration, and cavity formation. Causes are, primary is aspiration of infected material from oropharynx. Secondary, from pneumonia, especially Staph aureus, or from bronchiectasis. There are 3 stages of lung abscess. Pneumonic stage, that's still initially with pneumonia. Acute abscess stage, when there are small zones of necrosis. Chronic abscess stage, is when more than 6 weeks of proper treatment, but without healing, and on X-ray appears regular thick wall of cavity surrounded by fibrosis. Patients in pneumonic stage come with pneumonia symptoms. Patients in acute stage come with high fever, headache, and cough with excessive sputum, but increase when sleep on the healthy side. Patients in chronic stage come with symptoms as acute, plus loss of weight, and clubbing, and anemia. X-ray show dense shadow, with cavity formation with fluid level. Third, infected cystic lung, which is anomaly development of the bronchial tree, with abnormally dilated bronchial wall, with bronchial cyst formation. Is usually in children, and there are 2 types. Central congenital cyst, that is solitary with no connection with bronchial tree. Peripheral congenital cyst, that is multiple with connection with bronchial tree. And there are no symptoms or signs if no infection or if central type. And on CT, show soup bubbles appearance. Fourth and finally, the empyema, is infected pleural fluid, with abnormal bronchopleural fistula. Causes, could be directed from a adjacent pneumonia, or rupture of lung abscess into pleural space, or trauma. Symptoms is lung abscess. An X-ray show hydropneumothorax. As you know, it is a pus in pleural space. Thanks for listening, I hope you learned something. That was all today. Thanks again and subscribe for more.